most common myths that you encounter when you teach ultrasound?
I think the very most common myth is that ultrasound is easy. So many times, well, sonographers make it look easy. It's just a bit of gel on the tummy, and then you just rub the probe over it, right? So it looks really easy. So easy, in fact, that I've had people who've had babies, and they're like, "Oh, I want to change my career, and let's do, the 3D pictures of the bub and make a go of it." And they think it's easy because a sonographer makes it look really easy. But unbeknownst, until you actually put the probe in your hand, unbeknownst to most users, once you've got that probe in your hand, it's actually quite a lot more difficult than it looks. Finding the right window, adjusting the control so that you're getting the best out of your machine is one skill. Knowing the anatomy and the 3D configuration of the anatomy and where things are in space is probably the hardest thing we find to teach. And actually just the tiny little movements that are required sometimes, and other times it's a really big movement of the probe. But the fine tune and the finessing of the probe movement in your right hand is probably one of the most complex psychomotor skills that we can teach. So I think the myth that ultrasound is easy is the biggest myth that we face. I think the second most common myth that we face is that people think, oh, I've attended my course, so now I'm competent in ultrasound and I have the skills to go back and use them clinically. And I guess this is the one that concerns me the most, because unlike some of the other courses, like you do a first aid course, at the end you pass your exam and you get your certificate that says, right, you can do it. Unlike some of the other courses that people do, an ultrasound course is just the beginning, and it just gets you over that initial very steep learning curve of how everything comes together. Then when you go back to your workplace, there's a heck of a lot of skills development to do. So, it's one thing to actually hear the skills and practice the skills in practice at a course, where, sometimes those courses can be set up with very selected patients. If you've got a whole heap of nice, young, fit and medical students, their anatomy is quite easy to demonstrate, and it can send people off with a bit of overconfidence in their skills. And then when they go back to the workplace, they hit reality, and all of a sudden you've got an overweight chap or someone who has been smoking all morning and has got heaps and heaps of gas in their belly. And so when you translate those skills that are learnt in the course, and if you've only practiced on the ideal patient in your course, when you hit reality back in the real world at the workplace, it can be very, very difficult to scan. So certainly at our place, we select skinny patients to start the training process to build confidence, and then sort of later on we try to get people who don't have an easy window, who are a little bit more challenging to scan. And even then we can't truly replicate that patient who's arresting, obviously, and we don't want to, but you can't replicate all the nuances of what's actually going to happen or simulate all the nuances of everything that's going to happen in the workplace. But it's very easy to walk away thinking, oh, whilst I've had my coach standing over my shoulder and telling me how to get this, it was all very easy. And then they get back to their workplace and find that it isn't so easy. So I guess the second thing we sort of face is, oh, I've done a course and that makes me competent. I've done a course means I've just started this learning journey, and I might still need another 10,000 hours to become an expert in it. I think another common myth that we face is that you can learn everything you need to know about ultrasound on a simulator. The simulators, I think, are really good for those the first hour or two of teaching, where you can where you're just figuring out which way's up and where the anatomy is supposed to sit. So they're very useful at the beginning of teaching to start to get that spatial awareness happening. But I haven't seen a simulator yet that truly replicates the wide variability that's out there in the real population. You know, there's a pelvic simulator that's got perfect anteverted uterus, and then you get out into the real world. Some are retroverted, some bend off to the side, some have got more gas in front of them than the simulators can ever pretend to mimic. So the simulators sort of are great to start your training, and then they can come back in later on in the training when you're trying to concentrate on developing documentation skills and things like that. But they only sort of start the learning journey, and certainly they have to spend quite a lot of time on many different body shapes and different pathological conditions to understand the full gamut of anatomical presentations there are. Another one that we're facing at the moment in Australia is people have gone off and done their credential, and they might have done 25 cases, and then they think that makes them good enough to teach, that they're experienced now, and that we can tackle the training and teach our colleagues. 25 cases is just the beginning, and at the end of 25 cases, if you had a nice slim easy patient, you might have a good crack at getting it right. But I worry about a number of places where, you know, okay, I've got my credential after 25 cases, and now that puts me in an experienced position to teach, because just because you can actually do ultrasound doesn't mean that you have the skills yet to break it down to teach it effectively. So that sort of busts the myth of the see one, do one, teach one. I know that kind of exists out there, but watching ultrasound on many videos, there's a whole range of free online access medical education, and there's a whole subsection there about how to do ultrasound. The watching ultrasound on videos is great to develop the pattern recognition, but it doesn't matter how many times you watch stuff online. That doesn't mean that you can actually go and perform the ultrasound, hold the probe in your hand and get the view. This would be kind of like asking a learner driver to learn how to drive a car, watching a few videos online, and then putting them in charge of a car and saying, righto, you've watched it online now you know how to drive a car. It's a very common sort of myth that's out there, I think, that if I watch enough of this and learn about it enough online, that I'm going to be able to do it well. And I think it neglects the whole the actual doing of ultrasound. That complex psychomotor skill is the hardest bit. The holding the probe in the hand and being able to get the window is the hardest part of all of it. So the videos help contribute to the learning and are not useless. They're very useful in developing pattern recognition and understanding the theoretical constructs, but it doesn't help to be able to get the actual picture and to be successfully acquiring an image that is diagnostic. So that's another a common untrue thought, I guess, that's out there that we face all the time, is let's watch enough TV and then we can do it. So if you've got your person who's learned their 25 scans, they've watched heaps and heaps of videos, and now they think they can teach, I don't think it after even 25, even after 300 scans, that they have enough skill yet to be able to break the task down and to be able to teach it. But that doesn't just apply to ultrasound. I think it applies to anything. There are some things that you might be very, very good at, but you can't teach it. And I think the teaching of ultrasound is a skill in itself. And there's not everyone can do it. Not everyone can successfully deconstruct those complex skills and break it down into smaller component parts to be able to teach it effectively. So there's a couple sort of rolled into one there, but I think they're my biggest myths that we face. The ultrasound is easy is the biggest one. I've done my course, and at the end of that, I'm going to go out and be competent. I'm credentialed now, so that means I can teach. And if I watch enough TV about this, and if I watch enough online videos, that means I know how to do ultrasound. I think they're the big myths that we face. And sort of one extra on the side is that ultrasound's the panacea for everything. That if I can do ultrasound, it means that I don't have to be very good at anything else. And when we're teaching this, we always sort of say ultrasound is just one little piece of the puzzle. If all of your clinical signs and symptoms and everything else about what you're seeing about this patient adds up to one thing, and then ultrasound contradicts that, you've got to be pretty confident about your ultrasound to actually go with the ultrasound and overrule your clinical intuition. So ultrasound just forms one little piece of the puzzle and is not the panacea for everything.
Yeah, that makes a lot of sense. So then, as an educator, how do you approach or develop an education program to bust some of the myths that you outlined for us?
I think we've been going for 10 years now, and certainly our program as it stands now is very, very different to when we started. One of the assumptions that we made when we first started is that doctors know their anatomy. And we've just come unstuck so many times making that assumption. And I think that in itself is one of the biggest learning points as educators, is don't assume any knowledge whatsoever. And for us, now we specifically teach the anatomy and try to do some fun exercises that try to reinforce the 3D spatial conception of the anatomy. And I think that's probably the hardest. We've found that, surgeons who, and particularly surgeons who do laparoscopic surgery, pick up ultrasound so easily. And that's because they have a really good understanding of the anatomy. But the laparoscopic skills also develop their 3D spatial awareness, unlike anything else that other docs can do. So some of the things that we've done, and what we keep having reinforced over and over again, is to break it down further than what you think. So don't assume any knowledge. Don't start halfway up the ladder. We've had several docs over time who've gone and done other courses, and often they've been physician-led courses. So the physicians just want to teach each other about, here's how you can use it in practice. And what they neglect to do is to cover the basics really, really well. How do you hold the probe? How do you move the probe to get the pictures? How do you use the machine to get a better, to optimize the image so that you're getting a better picture, and then you can have a better diagnosis because you've got a better picture. So we've had several people who've come to our courses, who've done several courses, and then spend the first morning with us and then go, geez, well, I've had my value out of the course already, because just by covering the basics properly and doing the basics really well, and not jumping over those things that are seemingly really boring, but are so vital to actually developing good skills in ultrasound. So our courses break it down and cover the basics really, really well, I think, and don't assume knowledge. Another sort of thing we've faced is, well, I'm a registrar, can I do this course because it'll be consultants? Or I'm a consultant, is this just for beginners? And we've always sort of looked at had a viewpoint on this, that a novice ultrasound user is a novice ultrasound user. And I don't care whereabouts in your career pathway you are at, whether you're associate professor or a medical student, a novice ultrasound user is a novice ultrasound user. And if we're assuming no knowledge and breaking things down and covering every step along the way, then the stuff at the end, the actual clinical application, that starts to become very easy when you've built solid foundations to start with. So I think that's the key to our education program, is just building the foundation right and teaching people the basics well to start with before getting into the interesting stuff, as they put it.